Happy Friday, everyone, and welcome to Physio Move and Groove. My name is Jeannie. I'm a physical therapist with over 25 years of experience helping people to be able to move well, feel well, and be well. So super excited to be here today as I have a special guest here. His name is Trevor, and he is a collegiate level hockey player. So he has agreed to be my model, and we're going to be talking about Kinesiotape today. Now, I'm sure a lot of you have heard about Kinesiotape, but it's not just a matter of slapping that tape on and then going on your merry little way. You have to make sure that you put it in a certain direction. It also matters what kind of tension you put on the tape, and also the position that you put the body part in that you're taping. It really depends on what you're trying to achieve with the tape. So we're going to cover the three most common things that I use the tape for. So Trevor, have you ever used Kinesiotape before?
I have, yes.
And what did you use it for?
So I tore my hamstring playing hockey last year, and I used it on my hamstring during recovery. I also strained my right groin, so I use it on my right groin as well.
Okay, awesome. Did you feel like it helped you when you wore it?
Yeah, it was more, I guess you could say it felt more tight. Like it held it together better, like when my hamstring was recovering.
Yep.
So yeah, I liked it.
Okay, cool. So benefits of using this Kinesiotape are often to help to decrease the stress and strain that is put on a muscle if you've torn it or you've strained it. It can help to rest that muscle too and allow it a chance to heal. And what would you say is the most common injury in goalies?
I would definitely say like inner legs, probably like the groin area, because there's a lot of, you're making a lot of desperation saves, cross crease, fully extending your body to make the save. So you're definitely putting your legs in a vulnerable position. Okay,
sure. All right, so seeing as Trev is already sitting here, we're going to do one of the most common ones that I have done in my practice over the years, and that is to tape for your knee. So it could be patellofemoral pain, could be knee arthritis, could be a tracking problem of the knee. You can use this type of technique. So first and foremost, what you want to make sure is that the skin is clean. So if you have any lotions or anything like that, you want to try to wash it off as much as you can. And also, you don't want to go in and do your sport right away. The tape actually sticks with an adhesive, so you want to have time for that to be able to stick to your skin. And if you just go and you start your sport right away, you're going to wear it off and it won't stick. So we're going to get started in our first position here. So what you'll see with the tape is you want to actually round the edges. That way it's not going to curl up on you. And then for this particular taping technique, you're going to take your piece of tape and you're going to actually put a cut right in the middle, because that's going to go at the top surface of your kneecap. So the very first piece of tape you're going to do is actually, you'll start with your leg bent, because again, when you've had any kind of a strained muscle, you want to have the muscle on stretch. So super important when you're placing the tape that you're going to have the muscle on stretch, and that is the position that we're going to actually tape this in. So we're going to take our first piece of tape. You're going to basically tear off the anchor. So the anchor of your tape never has any kind of stress or strain on it. You just kind of lay it on the top. At the edge here, where you'll see that little Y, you're going to put on the top of the kneecap. And so then you just lay that tape down. And you'll rub it the top there to kind of put your anchor. And now for the very first piece here, you just peel it off. You're not going to actually have any tension on the tape. You're just going to peel that off to the top of that kneecap. And you'll place that down, and then you're going to rub it down. I'm not going to be too mean to you, Trev, so I'm not going to you would actually rub this down for about a minute so that it will stick. But seeing as I don't want Trev to have to worry about taking that off, we're just going to rub it for a little bit. And then you have your tails. So the two tails here, you'll take that tape off. You're going to basically just wrap it around that kneecap. You're going to have him bend his knee as you wrap it around that kneecap. And the same thing here, you're going to rub that down. Again, you probably spend about a minute rubbing that tissue down. And go around again. So you're basically just surrounding that whole kneecap, and then you're going to spend a whole minute rubbing that down. Now for your second piece, it's going to be kind of the same thing, except you're going the opposite direction. So that Y that's there is going to go on the bottom half of where your kneecap is, and this piece will go on the front of your shin. So same thing, you're going to tear it off That's going to be your anchor. Again, there's not going to be any tension in that area. You'll just kind of lay that down. And then you'll pull off that tape. Again, there's not going to be any tension there. And you'll kind of just lay that there. Then you're going to get that knee to a full bend. Now these other ones, there's two different ways you can do this. You can either wrap it around that kneecap again, or what I found what works for most people is you'll actually apply about a 25% tension and you'll go on either side of that quadricep muscle. And then the same thing over on the other side. Again, you're laying those tails down with no tension at all. And then you're gonna rub that whole area for about a minute so that that glue can adhere. And there you have it, folks. That is the taping job for your patellofemoral syndrome. All right, folks, so here we are. We're going to talk about now taping for the hamstring, which Trevor knows something about since he has experienced his hamstring tear. So as you can see, he's got his hamstring on stretch. Again, anytime that you have a strained muscle, we want to quiet down that muscle. So you want to be able to tape it when the muscle is actually stretched. And also you want to go from where the muscle inserts to where it originates. So in the case of the hamstring, you're going to go, it really inserts at the knee, but you don't want to actually tape it in the knee joint because that's where you need to bend. So you'll go above the back of the knee and then you'll just bring it up. You're going to end up putting about 25% tension on the tape, and you're actually going to tape it all the way up to your butt bone. But seeing as we don't want to make Trev be an exhibitionist, I'm just going to put it over top of his shorts for today. But at home, you're going to want to do this on your actual skin. So same as before, you're going to cut all the edges, one long piece. Same principle with the anchor. Anchor doesn't have any tension on it, so you're going to basically put this at the back. Now, I'm only going to do one piece here, but normally you want to do 2 to 3 pieces. So I'm just going to show you how to do the one piece because you'll do the other 2 and 3 the same. So you're going to go above the crease of the knee so that you're actually able to bend that knee. Again, you're going to pull that or push that down, that anchor, so it's nice and steady. Again, I'm not going to be too cruel here so you can actually get this tape off. And then when we talk about the tension, again, if you're thinking about it, that's 100% tension. I'm really yanking at it. So you back off to 50, you back off a little bit more, so you're at about 25% of tension. And then that's actually where you're going to lay that down. And again, I'm going over top of the shorts, folks, but you would actually put it on your butt bone. And then you're going to just tap that down and you're going to rub that. Rub it for about a minute so it can adhere to your muscle and your skin. And then you'll do 2 more on either side to get that whole hamstring. So there is the hamstring one. All right, so Trev and I are back again, and we are going to be talking about shin splints. So super common injury, especially for track athletes or any kind of jumping athlete. Basically, the most common area for shin splints are along the inside of your tibia. So when you're taping this, again, the same principles apply. We want to have the muscle on stretch. So he's going to plantar flex his foot down. So that's the first thing. And then the second thing is that we're going to start from where the muscle inserts to where the muscle originates. So general area is you're going to start further away and you're going to pull it up to closer to the top of the body. So you want to take a little X and you want to mark the most tender spot, because shin splints, although they're the medial side, where most of the time, it could vary different. So you kind of just palpate around and then you find out where the most tender spot is. So we're just going to make an X and pretend that that's where his most tender spot is, because for the second and third piece of tape, you're going to go above and below that X. So same principles. Again, you're rounding the edges so that they don't curl up on you. Same thing again with your anchor. There's never any tension on the tails or on the anchor. So you're going to place that down. You're actually going to go above where, like kind of over top of where that X is, because that's where he's having his pain. Again, there'll be no tension on the tail. You don't want to get it in the ankle joint because you want the joint to actually be able to move freely. Now this one, you're actually going to use about 50% of pressure. So when you take the tape off, again, if you pull on the tape, That's 100% of pressure. You're going to back off to about half, and that's going to be your 50%. And then you'll lay that down again for about a minute. You're going to put that pressure on there, and then you're just going to pull it off. And again, no pressure on the tail, no tension at all. And then you would rub it for about a minute to get that glue to stick. So now if you remember where that little X is, that's where you're going to go above and below the two other pieces. So you'll rip it off. That again is going to be your anchor. So you'll go below where that X was. You're going to place that on the outside. Now with this one, you're actually going to end up pulling it at about 80%. So if that's 100%, you're going to end up backing off just a little bit. And then you'll place it down. No tension on the tail. That's going to be the one that's below. You'll rub that down for about a minute. And then you'll take your other piece for the piece that goes above. Again, you're keeping that foot plantar flexed and pointed the whole time. So you'll go above. Again, you're going to lay that tail down. No pressure or tension. And then you'll peel the tape off. You're going to end up putting, again, that 80% force. So you are pulling it at 100%, and then you're backing off by about 20%. And you'll lay your tail down. It's also important that you don't really want to have any wrinkles in the tape as you're placing it down. That way it'll stick better, and you're not going to end up getting a sore spot anywhere underneath that tape. So there you have it for shin splints. Another important thing is how to get the tape off. So you want to be kind to yourself. You don't want to just rip it off like crazy. So the easiest way to get the tape off is to actually get it wet, or you can use baby oil. That helps to release the adhesive too. But you can actually keep the tape on for 2 to 3 days, sometimes even 3 to 4 days. It'll still be fine. You can shower with it. It is waterproof, so you don't have to worry about taking it off. But again, I do remind you that you want to make sure that you wash everything good before you put the tape on, and that you don't exercise right away. All right, so there you have it. We've got our shin splint, we've got our knee, and we have our hamstring taping. So thank you all for tuning in, and thank you, Trevor, for being my model for this Kinesiotape. And I really hope that all of you will subscribe to this channel, and also like the channel and give me comments too on what you'd like to cover in the future, because that's simply just going to make my heart smile. So in typical Physio Move and Groove fashion, Trev, we got to dance our way out of here.
Let's do it.
Are you ready for it?
I'm ready.
Okay, let's do it. Here we go. Oops, wrong way for me.
Oh dear.